Actually, this winter kind of reminds me of Arizona's winter. My God. Well, good morning. I do sincerely appreciate the opportunity to share my concerns relating to recent and potential future state cuts on health and human services. In a survey that we recently conducted among our 45 partner agencies that we support in this community, it showed that our agencies endured $9.4 million in state and federal cuts over the last 2 years. Again, that's $9.4 million lost for vital health and human care services and programs that help residents here in central Illinois in Peoria, Tazewell, Woodford, Stark, Marshall, and Putnam counties. We are obviously concerned about this because it negatively impacts the overall health and well-being of our community. We are also concerned about additional state cuts being made, again falling on the backs of the most vulnerable in our community, which includes many at-risk youth. Let me share with you a sobering statistic, and actually Cleet mentioned this as well, that 1 in 5 Illinois children live in poverty, and more than 33,000 homeless children were enrolled in the state's public school system. Again, 20% of our children in the state of Illinois are living in poverty. Now locally, recently we conducted a comprehensive needs assessment or community assessment with Bradley University. So I pulled some stats from there, and locally, for families with 2 parents, the poverty rate is 5.5%, and that's a 2.5% increase since 2006. But more staggering is families headed by a single mother, the poverty rate jumps to 40.7%, not 14, 40%. At the same time, with these increased poverty, state programs impacted by the budget cuts include early childhood education. Between fiscal years 2009 and 2011, the combination of budget cuts and delayed payments to service providers resulted in 11,400 fewer children being able to participate in pre-K programs that enhance school readiness skills for young children. The additional budget cuts for fiscal year 2012 could mean the loss of pre-K services for another 6,700 children. Another cut, opportunities for at-risk youth. State funding for Teen Reach for after-school programs, which offer prevention-focused services for at-risk youth, has been cut in half since fiscal year 2008. And mental health services, since fiscal year 2009, state funding for school-based and community-based mental health services for children and adolescents have been cut by 20%. Now, recently, you've probably seen on the paper that there was a fire that took the lives of 2 children and a father while their mother was working. Community and state-funded agencies like Salvation Army, Goodwill, and Family Corps are there providing critical support services, including food, shelter, and clothing. It is paramount that the state does not continue to significantly cut these programs that provide the safety net of services for the most at-risk in our community. As said earlier, investing in opportunities for at-risk children now will only provide a healthy return, ensuring an educated and qualified workforce in the future for Central Illinois.
So we've looked at it from 30,000 feet. We've looked at it from a perspective of the physician, if you will, the medical field, keeping track of the pulse, the well-being of our community. Thank you, United Way, for doing that. But now we get to the soldiers on the ground, the people doing the work day in and day out, and the impact that it has right here in this Center for Prevention of Abuse. We have Martha Herm with us next. Martha has been the executive director of the Center for Prevention of Abuse since 1990. She says that every day she leans on her previous experiences in teaching, business management, public relations, and community organizing, along with her master's degree studies in public administration from the University of Illinois Springfield. She shares her time and talent with various state and local coalitions, as well as the Rotary Club of Peoria, which I am a member of as well, and her church. So may I introduce Martha Herm.
Thank you all for being here. Well, we've been listening to the grim statistics that are telling us that life is not good for many, many children in our community. And as shown in the materials and already mentioned, 1/4 of the children here in Peoria live in poverty. But I've been asked to highlight a major reason that children are living in poverty and what happens to these kids. Domestic violence is a major reason that children are poor and are homeless. Several studies show that 50% of all homeless women and children are in that situation because they have fled a domestic violence situation. Now, even though domestic violence cuts across all socioeconomic lines equally, because there are a lot more poor people than wealthy, the gross numbers of low-income women who are domestic violence victims is very high. And what bears this out, I think, are the statistics that we just talked about in terms of single parents being mostly female. To be clear, men are also victims of domestic violence and also single parents, but are certainly in the minority. So therefore, in my remarks, I'm going to refer, though, to the victim as female and the abuser as male. Poverty makes it very difficult to end domestic violence. You know, reducing the risk of domestic violence will not make women and children safe without also providing opportunity for their long-term financial stability. And conversely, just addressing the domestic violence victims' economic resources and access to programs without addressing the impact of violence will not solve the problem either. So for example, just because a victim leaves a relationship, finds housing and a job, she is still vulnerable to her abuser's attacks or his sabotage of her job, her housing, her custody of the children. So the two have to go together, stopping the violence and helping them economically. But it's a chicken and egg situation for the victim. You know, it's very easy, and we all do it. It's easy to condemn the single parent for not giving her child proper nurturing and nourishment to help them thrive. But we equally condemn her if she stays in an abusive situation. So she's caught between a rock and a hard place, and the choices are terrible. Does she submit herself and her children to ongoing violence and abuse, but continue to have a roof over her head, food on the table, access to a car, health care, education, and child care, and he's not abusive all the time? Or does she leave and plunge herself into the potential homelessness and poverty? No roof, no food, no car, no health care, no money to hire a lawyer to get a fair divorce and child support. The choice is not just about the relationship, it's about basic needs. The choice is especially hard during this economic downturn. Where are the jobs that a single parent can rise out of poverty? Often it takes 2 low-paying jobs to piece together enough income just to survive. So where's the time to help children with homework, to read to them, have fun with them, prepare good meals, and just cuddle and talk? We have certainly seen an increase in domestic violence cases in the last 3 years. At our offices in the 3-county courthouse, houses, and that's in Woodford, Tazewell, and Peoria counties, the number of orders of protection filed has jumped 40% from 2010 to 2011. One of the programs that we manage for a community collaboration is called Heart of Illinois Safe from the Start. It provides free therapy to children aged 0 to 5 who have experienced or witnessed some kind of violence and abuse. The phone is ringing off the hook. In our elder abuse program, the number of grandparents raising grandchildren continues to climb. But these are just some of the indicators that tell us that there are many families in trouble, because we see an average of 5,000 victims of violence a year, of all ages, all classes, and both genders. So what does domestic violence and homelessness do to kids? That's why we're here today, to talk about that. This is what we see in the faces of kids who come here. They're afraid to go to school. They're afraid to leave their mother by going to school, wondering what's going to happen to her. Where are they going to live tonight? What are they going to eat? They're afraid to go to a new school if she pulls them out and perhaps comes to shelter. They may be bullied. They're shy about, meeting new friends, new teachers. What are the new rules in this new school? They're afraid of looking stupid. I mean, the study tells us that children lose 4 to 6 months of academic progress by changing schools one time. Just think what happens when they change schools several times in 1 year. When they walk into a classroom, besides being fearful, they may be hungry. And their worry that they have about what's happening in their family explodes into headaches and stomach aches, so they miss a lot of time in school. They may act out or bully others because they're angry about what's happening to them. So the classroom's disrupted, and their reputation as a bad boy or bad girl is certainly sealed. Who of us could learn in this situation? Who of us could concentrate? Who of us could be friendly? These children are worried. Will Dad go to jail? Will we be sent to a foster home? Will we ever be able to go back home, to my room, to my toys, my friends, my pet? How can I help Mom? How can I protect her? Why isn't Mom paying more attention to me? Because I'm really scared. I don't know how to take care of my little brother or sister. I can't do my homework. Was it my fault? And we don't think about this, but as adults, sometimes we say things that we don't really mean when we're frustrated or angry or whatever. So an offhand comment to a child, they twist to think to themselves, oh, I maybe caused that domestic violence. I've caused us to flee to shelter. I've caused what's happening in the family. Agencies like the Center, Children's Home in Crittenden, and others, as well as schools, and I'm so happy to see Dr. Latham here. Thank you for coming this morning. We're all expected to fill the gaps for children that are not being met by parents. The gaps widen because we have a very mobile society. Our extended families are scattered and not able to help like they were a few decades ago. I have to admit I was a single parent, and I cannot imagine how I would have managed had my parents been living across the road. And I know I was one of the lucky ones. When agency and school budgets are slashed, which we've heard about, our ability to fill those gaps diminishes. The strong safety net that I think we've built together with the help of United Way and others, it's becoming very frayed and weak. It's being strained by more and more people coming to get our services. When a society ignores the health and well-being of our children, I think our communities die a slow death, because what happens in the home does spill out into our schools, our workplaces, and our streets. We have to do everything possible to end violence in the home and enhance the ability of both parents to be self-sufficient. When children grow up in an abusive home, they are 1,000 times more likely to be a victim or an abuser when they become an adult. So we have to have supportive families and communities because they are critical to building a strong foundation for children. And we have to remember they are our future caretakers as well as our future leaders. So it's in our best interest to give our children a good start.
According to the Illinois Kids Count 2012 report, children are caught in the budget crossfire at both the state and federal levels, why policymakers are neglecting critical long-term investments in children. Investing in opportunities for children now can help ensure a qualified workforce and a future well-being of everyone in the state. That concludes our press conference, but I would open it up to any questions for our speakers, if anyone may have one.